Let's take another look at Chapter 13 of the peripheral nervous system from our Human Anatomy and Physiology text. In this section, we're going to take a look at regeneration in peripheral nerves, something not possible in the central nervous system so far, the technology we have, and of course this is natural, as well as the 12 cranial nerves that connect the brain and brainstem to the rest of the body. Although neurons are mainly amitotic, if an axon of a neuron or a nerve with many axons is damaged or severed, the part of the axon distal to the injury, means away from the cell body, will die. It won't have any support or sustenance coming from the cell body, and that degradation is called Wallerian degeneration. We'll look at a series of cartoons showing that then macrophages come and clear the debris, the fragments of the dead axon and destroyed Schwann cells. Macrophages, that's kind of their thing at sites of inflammation to not only gobble up invading microorganisms, but to clean up debris. And then the Schwann cells will create what's called a regeneration tube. They'll sort of form a cylindrical pathway where the original axon was, or axons were, and they'll secrete growth factors that will trigger outgrowth of little filaments from the proximal part of the axon is still attached to the cell body. And in the end, we'll grow some new neuron axons. So here's a cartoon of a multipolar neuron showing destruction of the axon. Of course, again, it could be a whole nerve, but many axons. We see fragments of the axon and of the Schwann cells, the myelin sheath that was around it. After that injury, then the downstream portion of the axon, away from the cell body, will die. That's Wallerian degeneration. And macrophages will come in again and clean up and recycle the components of the axon fragments and the myelin sheath of phospholipids. The Schwann cells will then reproduce and form a cylindrical closed, quote, regeneration tube that follows the course of the original axon and secrete growth factors, peptides that can bind to receptors on the axon and cause it to sprout outgrowths, and eventually the axon will continue to grow through this regeneration tube all the way down to where the original terminals were and form new terminals. Now, the connections may not be the same as they were before, but your central nervous system is amazingly plastic, meaning it's able to essentially relearn what connections are present on what neurons and sort of make sense of things and still function to a degree. Here we see the new axon forming within the regeneration tube. The Schwann cells will remyelinate this axon and we'll wind up with a healed nerve. It'll never be the same as the original. It'll never have quite as much fine motor control or sensory inputs, but at least we'll have some nervous system function, whereas none was there before if you have an amputation, for example. In the central nervous system, things are different. If you transect the spinal cord, the neuron axons will not attempt to regrow down the spinal cord. One of the thoughts is that growth-inhibiting peptides or proteins are secreted by oligodendrocytes that will block the regeneration of those axons. Astrocytes will form a scar tissue of chondroitin sulfate. Chondroitin sulfate also blocks axonal regrowth. Experimental strategies involve inhibitors of these blocking agents, so that possibly allowing axons to regrow in the case of a spinal cord injury, for example. Okay, so there are 12 pairs of cranial nerves that connect to the brain and brainstem to the rest of the body. How do you learn the 12 cranial nerves? Traditionally, mnemonic devices like this, such as what we talked about in lab, have been used to learn the names of the 12 cranial nerves, and then it's still an additional step to learn the functions. But the first letter of each of the words of this silly sentence represent the first letters of each of the 12 cranial nerves. So once you can memorize one of those mnemonics and can make a list of 1 through 12 in Roman numerals, then you can start to write down and remember the names of the cranial nerves. And here they are shown in this diagram, again similar to what we talked about in lab. So let's take a look at the 12 cranial nerves here in this table. I will not go through the 12 cranial nerves discretely right now. That was our responsibility in lab, and there will be a lab test coming up in which you'll have to be able to report out on the sensory and motor functions of each of the 12 cranial nerves listed on the left here. I would like, however, to go over a couple of homeostatic imbalances associated with some of these cranial nerves, just because they're interesting. They're things I thought you should know about. The olfactory nerves, cranial nerve 1. Those olfactory nerves, the bulbs of the olfactory nerves, sit in the cribriform plate of the sphenoid bone and have axons that travel to the olfactory cortex in the medial temporal lobe, and the actual sensory hairs pass down through the foramina of the ethmoid bone, the cribriform plate, to form receptors in the nasal cavity. Excuse me. However, if there's a fracture to the anterior cranial fossa, that sort of the hollow, concave forward part of the cranial box, it will very possibly damage the cribriform plate and all these very, very delicate sensory hairs that are sticking down through there, and the victim may experience anosmia, loss of the sense of smell. The optic nerves. The optic nerves, two large trunks coming from the retinas, carrying all that information about light and dark regions and colors and movements and so forth, travel through the optic foramina of the sphenoid bone to the optic chiasma, where many of the fibers cross over to the opposite side. Some of the fibers stay on the same side and travel posteriorly to the optic cortex in the occipital lobe, to the visual cortex. I wanted to alert you to something cool about the layout here of the tracts. So let's follow the progress. The axons coming from the left side of each eyeball, the left half of each retina, travel to the same side of the same hemisphere of the cerebrum, the cortex. Right here we see the right-hand axons from the right-hand side that come together from both eyes into what's called the optic tract, to the hypothalamus, and then to the occipital lobe, the primary visual cortex and visual association cortex. So the consequence of that is, if there's an injury to one eye or to an optic nerve, then that eye will become blinded and will lose a fraction of the field of view, right? Because the nose is in the way, only this right eye can see far to the right in the peripheral range, whereas this eye can't. But only this eye can see far to the left. So if we lose this eye, we won't be able to see that far left part of the visual field anymore. All right, what if we damage the optic tract, or the thalamus, or the occipital lobe, where the visual cortex is in one hemisphere? Since these axons travel from the same half of both retinas, we'll lose half of our field of view. It's called hemianopsia. Isn't that interesting? So people that have damage to an optic tract because of a trauma or a tumor will have hemianopsia. They'll see one side of the field of view will be present, and the other side they'll see nothing. Fascinating. Quite distinct from what happens if you lose an eye. Oculomotor nerves can move the eyes one way or another, and without the oculomotor nerves, we have the inability to move the eyeballs correctly. Same thing with the trochlear nerves. So loss of trochlear nerve function will also result in inappropriate failure to be able to move the eyes in a particular direction, laterally and down. The trigeminal nerves, they carry sensory information from the face and from the oral cavity and nasal cavity and orbits. There's a cartoon showing the trigeminal nerve. It's traditionally thought of as, or is in fact, divided into three branches, and they're named traditionally according to the regions of the face that they report from. I just wanted to alert you to a homeostatic imbalance associated with that sensory nerve, the sensory function of that nerve, and that is called tic-douloureux. Tic-douloureux is a severe debilitating tendency to experience bouts of short bursts of stabbing pains through axons in in part of the trigeminal nerve. It may recur many, many times a day for some people, and the pain is so severe that it's impossible to ignore it and concentrate. So it causes a tremendous amount of loss of productivity and just a miserable quality of life for people that experience this situation where the trigeminal nerve becomes inflamed. In some cases, the condition persists in such a way that the branch of the trigeminal nerve where the origin is of the pain signals must be surgically destroyed or ablated. Abducens, another nerve that controls eye movement. The facial nerves. The facial nerves control muscles of facial expression, as well as salivary glands and lacrimal glands and so forth, and taste sensation. Well, there's a homeostatic imbalance that's interestingly associated with the facial nerves. Sometimes, there's just a cartoon representation of the pathways, the anatomy of the facial nerve. After a viral infection, in rare cases, someone might experience what's called Bell's palsy. They may wake up in the morning and find that one side of their face is completely paralyzed. None of the muscles can operate, and they can't close their mouth, they can't close their eye. Tears may weep out of the eye. Saliva will drool out of the corner of the mouth and so forth. There's no movement of any muscles on that side, and it's usually self-resolving in 2 or 3 days. It's a very unnerving thing should it happen. So I just wrote down some of those things here. Herpes viruses, for example. Human herpes viruses, there are 8 different human herpes viruses types, I believe, and they tend to exhibit latency. After an infection, a lesion caused by an infection with these viruses, the viruses retreat into the body of or the ganglion, into the body of a nerve, a peripheral nerve, and reside there for unknown period of time, and eventually, for some unknown reason, may suddenly be induced to multiply and then travel down the axon to the periphery through the axonal trafficking system, the molecular motor system, and cause another outbreak in the body, in this case causing Bell's palsy. Vestibulocochlear nerves, those are nerves that carry sensory information from your cochleas and from the vestibular apparatus in your inner ear that alert your body to the positions of your body, then the movements of your body by way of acceleration, either linearly or rotationally. The glossopharyngeal nerve, some of these are just listing out the nerves. I don't have a specific homeostatic imbalance to observe about the glossopharyngeal nerve, so don't worry about it. The vagus nerve I would like to focus on for just a second, because cranial nerve 10 innervates organs throughout your thoracic and abdominal cavities, even though it's one of the cranial nerves, so it's somewhat unique in that way. So the parasympathetic nervous system is largely housed in the vagus nerve. So we'll come back and talk a lot more about the vagus nerve when we talk about and the parasympathetic nervous system. We'll talk about chapter 14, the autonomic nervous system. Accessory nerves are a little bit like the vagus nerve in that they control the trapezius muscle and sternocleidomastoid muscles, which are not in the head, and well, sort of in the neck, I guess, and the hypoglossal nerve. All right. Most of the cranial nerves are mixed nerves in terms of motor and sensory function, but not all. Some of them are also mixed nerves having both somatic and autonomic function. There's a mnemonic device to remember which cranial nerves have sensory function only, motor function only, or both. So there's a silly sentence that you can use to take, once you have your list of 12 cranial nerves, and you want to try to remember their functions, you can then put this list of first letters down and remember that which of the nerves have sensory, motor, or both functions, and then that'll help you filling in the rest of the functions. All right, so join me now for next time. For part 4 of chapter 13, and we'll talk about peripheral nerves.